Welcome to Medicanova Wellness Studio. I'm Angelica Maria Koch with your educational videos about optimal health and the most innovative and holistic approach to your well-being. So let's continue with our Discover series, Heathy Family and Soul Medicine. And today's theme is all about how to treat pink eye or conjunctivitis with natural and effective therapeutic tools. This video is so important for young parents, the newborn babies or toddlers, because pink eye is quite a common symptom. So you really want to know how to handle the situation and how to treat it in the most holistic way. To stay updated with more educational videos, I encourage you to subscribe to my channel, share and like it with your friends and family. If you want to know more about my work, have a look at my website medicanova.net at the online academy, where you will find comprehensive home study online courses in first aid homeopathy for the whole family, as well as educators and quantum healing. And if you're interested in a personal health consultation, either for yourself or your children, contact me at health@medicanova.net. So what's a pink eye? Well, pink eye, also called conjunctivitis, is an eye infection. It usually displays itself with swelling of the eye, redness, there can be itchiness involved, tearing like a watery discharge. And in babies, you can see also, like we call it a mucopurulence, sort of like a little yellow discharge coming out of the corner of the eyes. It's caused by bacteria or a virus, and therefore it is contagious, and therefore it becomes a common symptom. Now, if it's bacterial caused, then usually can resolve itself within 10 days. If it's a viral infection, it usually lasts a little bit longer, can be from 2 to 4 weeks, or even longer than that, if it's chronic then. Again, it starts sort of with a tenderness, swelling of the eyelid. There's something not right. Now, unfortunately, the symptoms of the bacterial infection and the viral infection are very similar. It's very difficult to distinguish what causes what. But as a parent here, I urge you, please do so. Find out first what caused it, because you want to find the right treatment plan as well. You maybe go to your doctor and he or she gives you an eye drop or antibiotic, but if it's based on a viral infection, it won't work. Or your child has the pink eye, it's already quite upset about having itchy eyes, or there's a discharge coming out, and you then start giving the antibiotics and it's a viral infection, it will be just a blow into the dust. It's like antibiotics won't work with viral infection. So I really urge you here, try to find the right treatment plan, the best information, and in this video I will share with you natural and holistic protocols which work both for the bacterial infection and the viral infection without side effects. So what are the common symptoms? So it starts usually with a small blood vessels of the conjunctiva, which is this transparent membrane which lines the eyelid as well as the white of the eye. We call it the sclera, and that membrane gets inflamed, and therefore we have the pink eye. The whole condition is caused by a virus, a bacteria, but it can be also an allergy or an irritant, as well as sexually transmitted disease based on chlamydia or gonorrhea. Now, the main symptom again, it's usually redness, swelling, itching, there can be watery eyes. In babies, you can see the sticky eyelids. So, you go to your baby in the morning and the baby tries desperately to open up the eyelids and can't, because now the dried crust stuck the eyelids together. And the parents get usually quite concerned, but I show you how to deal with this. If it's an allergic conjunctivitis, the name would be allergic rhinoconjunctivitis. Then the respiratory system comes in. Then we have sneezing and water discharge maybe out of the nose as well. With all of that, you can have light sensitivity, photophobia we call it, or even blurred vision. Right? So it's quite a complex situation. But let's have a look at how you can differentiate between the bacterial infection and the viral infection, right? Before you even look for some measures. The bacterial infection, of course, it has the redness and the swelling of the white of the eyes, and the eyes are all infected. It can be tearing, there can be burning sensation in the eyes. There can be even a mild pain because the conjunctiva is very sore, so it can be painful. But here you have the yellow-green discharge coming out of the eyes. It's quite sticky, the eyelids stuck together in the morning. That's what you see with the babies. The eyelid may be even in itself swollen and sort of look a little bit droopy, hanging over the eye. In the viral condition, you don't have this sticky discharge. You have more a fluid, watery discharge. That gives it away. Of course, it's caused by a virus, and usually it's the adenovirus, but it can be other viruses as well, like herpes virus or chickenpox, varicella virus, or more viruses involved. And it lasts longer. It usually takes 2 to 4 weeks, or if it's chronic, then it drags out a little bit more. So if it's an allergic reaction, you also see this inflammation more in both eyes rather than in one with bacterial or viral infection. Both eyes are affected. As I said, the respiratory system may be involved, and actually it affects a lot of people. They say it's about 40% of the population experience, allergic rhinoconjunctivitis. As I said, it can be triggered by animal hair, pollen, anything from grass pollen to tree pollen, anything on that, as well as house dust mites. And here I want to bring in something else. It's called the histamine intolerance. So the body produces an antibody called immunoglobulin. And that sort of triggers, we call them mast cells, and they are in the mucous lining of the eyes. And they release this substance called histamine. Maybe you heard about it when you have like hives or nettle rash and you go to your doctor. He or she will prescribe antihistamine medication. So when you see this pink eye and this redness and this swelling, it's caused by an stimulation of histamine. And it stimulates the dilation of the blood vessels as well as the nerve endings where they have the itchiness, and also the secretion of the water coming out of the tears coming out of the eyes. But it usually resolves by itself. It's not a big deal, but you maybe have sneezing as well and the runny nose and all of that. I'm not going to go into this video about sexual transmitted conjunctivitis based on chlamydia and gonorrhea. Please go and see your doctor or your holistic healthcare practitioner here. But let's have a brief look at the metaphysical meaning of the expression of a pink eye. As you know, the body and mind are not separate, they're all one. And if it's a chronic situation and not just based on being susceptible in that moment for the bacteria or the virus, then look at the story behind the expression of the symptom. Right? There's something which triggers you to have chronic eye infections. And here I'm talking about also styes, right? Regular styes, if you're prone to that. Usually there's an anger involved as well as a frustration about something that you're looking at in life, right? It can be in your workplace, in your marriage with your spouse, even with your own children. What is triggering it? What is it what you don't want to see or don't want to look at in life anymore, which causes your eyes to be irritated. Louise Hay has a wonderful affirmation here, and she once said, "I see with eyes of love." There's a harmonious solution, and I accept it now. Even in your children, if you see chronic eye infections, I would say talk to your child. Maybe he or she doesn't want to look at what's going on within the family dynamic. Parents are about to get divorced. There's screaming going on, lots of quarrels going on. There may be jealousy, among siblings involved. There may be a residential move. There may be change of school. Whatever it is, have a look and talk to your child. What is irritating he or she in such a way that that she doesn't really want to look at this stuff anymore? They could be just that, apart from, as I said, having contracted the virus or the bacteria. But let's talk about my favorite home remedies here. First one is Tulsi, which is the basil leaf. Easy peasy kitchen pharmacy. Doesn't cost you much, but works. Tulsi has wonderful healing power. It is anti-inflammatory, has soothing properties, and it also protects the eye from environmental damage, particularly free radical damage. It fights viral infection, bacterial infection, as well as fungal infection of the eyes. You got a bunch of basil leaf, get a pot of hot water. Don't boil it too hot, just sort of simmer it a little bit for a few minutes. Let it cool down, and then get your eye bath, or you have a washcloth or cotton wool, soak it in and put it as a warm eye compresses several times of the day on your eyes. Really, really helpful here. Aloe vera gel. You want to sort of dab it around the eye, not inside the eye. Be careful here. It's a very cooling agent. It contains aloe and amodine, which are very antibacterial and antiviral properties. Really nice combination here as well. Of course, I have to mention turmeric. Turmeric heals pretty much everything inside the body, but it's also great for eye infection. Again, it's antibacterial, antiviral. It relieves the symptom of an infected eye. In here, I would say 2 tablespoons of turmeric with sort of a cup of boiled water. And here, because it stains your clothes, it's quite strong. It's this saffron color. I would use some plastic gloves maybe to protect yourself, your skin, as well as your clothes. But get a washcloth or your eye cup and put it onto your eye. Really helpful here. Of course, you heard about the breast milk protocol. Works so well because breast milk is the most nutritious liquid on earth, and it really heals infected eyes. Unfortunately, that's why it doesn't work with bacterial infections so well. So you see the mother squirting the milk into the newborn's eye. It doesn't hurt the newborn, it's perfectly fine, but it's really more indicated with viral infections. So if that doesn't work, go for the herbal washes. Now, my favorite herbal eye wash is based on Rosemary Gladd's formula. She has wonderful remedies, and here I would say 1 tablespoon of powdered comfrey root and 1 teaspoon of powdered, has to be organic, goldenseal. It really works well. A cup of boiling water, put it together, and here you have to strain then this concoction either through 2 or 3 layers of muslin, or if you have sort of a very fine coffee filter, that will do as well. Again, use your eye cup or your eyedropper, put it into the eye several times a day. Usually takes about 4 to 5 days. Works very, very well as well. Other measures may be neem oil, you've heard colloidal silver, green tea applications, eye compresses work very well as well. But as I said, I just want to share with you what worked in my practice. How to prevent the spreading of the conjunctivitis? Well, I would say the first thing is wash your hands. As soon as you touch your eye, you drain your eye, apply medications to the eye, definitely wash your hands. Don't wear contact lenses unless the infection has really cooled down and you're sure that you're not passing on the virus or the bacteria. Dispose also the contact lens case, rather buy a new one unless you really sterilize it well. Again, wash towels, washcloths, linen, pillowcases. Really be conscious about it, not to spread the virus and the bacteria. With women, eye makeup, I would say, throw it away. Go and get yourself a new eyelash mascara, or, if you need the eyeshadow, just buy yourself a new kit, because it's just too sensitive here, the subject, to spread around the infection again. Same here with washcloths and even cotton wools. You always use fresh ones. My favorite here, and I really have to stress it, is homeopathic remedies. They're super effective. You can use it along with the suggested protocols I just shared with you, or alone. Either way. In this video, I will only share with you remedies which you can get hold of and have access to in your local health food store. Nothing too complicated, but super effective. Why? Because they manage very well the eye discharges, the swelling, the redness, even the gritty sensation where you feel like you have sand in your eyes. They really speed up the whole recovery, no side effects, right? And work on bacterial and viral infections. So what do you want more? And it's affordable and cheap. So go for it. Don't be afraid. This is easy peasy, and if you need help, contact me at health@medicanova.net. So today we talk about 3 major indicated remedies. It's called BELLADONNA, EUPHRASIA. I've got a picture up there which is really beautiful. It's a herb called eyebright, as well as PULSATILLA, which is the windflower. As you get the idea ready, conjunctivitis can have the mucopurulent discharge, the watery discharge, and whatever. So it can be quite confusing. So here I'm going to break it down in categories so you can spot it very easily and say, oh, okay, I need this remedy. Usually you get a number behind the homeopathic remedy. It's 6 or 30. It's just the potency. Usually that's the over-the-counter potency you can get off, and I will show you the dosage as well. If you have a pink eye, which is basically showing mainly the swelling, redness, and it's just sort of puffy, the eye, I would go for BELLADONNA 30. And here you have this marked swollenness, even a dry, congested eye, and also you have photophobia, very sensitive to light. BELLADONNA 30 for adults, 1 tablet daily, maybe morning and evening. Check it out for 2 or 3 days. Now, as soon as improvement sets in with homeopathic remedies, you stop. This is very different. Don't drag it out like an antibiotic course for 10 days. You stop as soon as improvement sets in. The major homeopathic remedy, which covers pretty much all symptoms throughout, doesn't matter if it's bacterial or viral, is EUPHRASIA. EUPHRASIA 30. And here you have, again, the redness, the swelling, but also you have discharges coming out of the eye, either watery, can be purulent as well a little bit sometimes, but more watery. And the discharge is quite acrid. So it burns the eye, it makes it itchy. And as I said, you have a very irritating nature of this pink eye. EUPHRASIA will do it. EUPHRASIA 30 for adults, 1 tablet morning and evening, again 2 or 3 days. For children, I would bring down the dosage to 1 tablet a day only for 2 or 3 days and see how that works. If you have a conjunctivitis, which is more based on watery discharge, so there's a lot coming out of the eyes, EUPHRASIA is your tip here. Thin discharge, itchiness, redness, there can be swelling of the eyes. Also the discharge can be quite acrid. As I said, it burns. If the discharge is just thin, watery, and you have this sort of gritty sensation in the eye as if there's sand, think of aconite 30. Aconite is wolfsbane, wonderful plant, usually grows in the forest. And in the homeopathic form, it's perfectly indicated on the sort of, in general, sort of first indication when you feel like, oh, you're under the weather, there's a cold coming on, sort of the first inflammatory stage, usually on the first day. It really kicks in quite well and covers it. But if you see that there's this sort of gritty, sandy sensation in the eye, think of aconite 30. Again, the same dosage for adults, 1 tablet morning and evening, maybe for 2 or 3 days. For children, only 1 tablet or 2, and only once a day. Now, if you see now thick, sort of mucopurulent, particular greenish discharge coming out of the eyes, then think about pulsatilla. You see that a lot with children, and here the child also becomes very clingy, whiny, needs your comfort, is better when you hold the baby, you know, it's like wants to carry it around. It's very whiny. And you see this sort of more yellowish, greenish discharge coming out of the eyes. Really good remedy. Now, I don't want to confuse you here, but I want to share something else with you too. If the discharge is more yellowish rather than green, go to your health food store and look for biochemic, homeopathic cell salts or tissue salts, they're called in Europe. There are usually 11, 12 different kinds of homeopathic remedies, but they're made in a different way. And here I would say Calc Self is very helpful here. They're soft tablets, and with adults I would say 4 tablets morning and evening for maybe 3 to 5 days. With children, only 2 tablets morning and evening, and you can combine that with 1 tablet Pulsatilla 30. So if you're totally confused and you don't know if it's a yellow or a greenish discharge, do both and it will work. Right? Now, if you have an allergic conjunctivitis, right? We talked about animal hair, house dust mites, or seasonal allergies. Again, EUPHRASIA. Go for this one first. Here we have the eye discharges, but it's also, as I said, irritating the discharge. It burns a little bit the eyes, there's itchiness involved, and you have maybe a bland nasal discharge coming out. So it doesn't irritate the nasal orifices, but it's definitely the eyes are very much affected. If you have an eye discharge, which is bland, but then the nasal discharge is very acrid, think about ALLIUM CEPA. It's based on onions. So if you're standing in the kitchen and you slice your onion, what would happen? Well, you would have watery eyes, right? And you start itching. It's the same thing. If there's a lot of water coming out of your eyes and it's allergically based, and you have this bland discharge coming out, basically it doesn't do anything. It's just lots of water and there's sneezing going on. ALLIUM CEPA 30, the same protocol as what was happening with the other remedies before. But if in doubt, contact me at health@medicanova.net. Now to the babies. You go in the morning to your baby. You know, it's all happy-go-lucky, and he or she tries to open the eyes and can't because now a dry crust has formed and stuck the eyelids together. And you feel like, oh my God, how am I going to get rid of that? Think of BORAX 30. It's a fantastic remedy. There may be even thrush involved with the babies as well, diaper rash, nappy rash. BORAX 30. 1 tablet, we usually deal with it. If it's a newborn baby, maybe want to go down to a lower dosage, BORAX 6. And here I would say 1 tablet morning and evening for 3 or 4 days. And if you just have BORAX 30, then give 1 tablet once and just see if that makes a difference. Really helpful remedies, very effective, and I can guarantee you it speeds up the recovery time, and they cover the bacterial and the viral infections. So I hope all these remedies were helpful for you, and I can, as I said, I can really give you with confidence back up here that you can deal with the situations as well. And as I said, why give your child an antibiotic if it's based on a viral infection? It wouldn't help anyway. Leave your comments below, or if you have any question, contact me at health@medicanova.net. This is not just me giving you the information. I invite you for an open forum here to join me and to just, giving yourself that space and time to educate yourself so you can help your loved ones and your family member, knowing very well I can deal with this situation, and I'm here to back you up on that. And also, if you're interested in my book, it's called The Dance of Your Core Healing, Transforming Your Mind, Body and Soul in the New World. Have a look at Amazon.com, or contact me, and I'm happy to share that with you. So till next time, much love. Take care.